Are we okay with that? Y'all hear me okay? Okay, it's not our normal time. We haven't had a week go by since our last surveillance report, so we don't have a surveillance report to go over today. We'll probably put out our surveillance report of the Monday after the holiday, but it'll be for the same time frame. I can tell you we're not seeing things change dramatically from what we talked about on Friday. Um, we're continuing to see a stabilization of the number of cases we have. Hospitalizations are pretty stable right now. That's all good. Those are good things. The most exciting thing that I have to report is this morning the health department took delivery of 300 doses of the Moderna vaccine. Those are already being distributed in the community. I just ran into a nurse in the hallway who was bringing back a couple of doses so we could hand them to somebody else. Again, right now, our focus continues to be on those frontline healthcare providers who are taking care of all of us if and when we get sick, as well as people in long-term care facilities. Those long-term care facility folks will be, we're hearing that will start happening next week. Those commercial pharmacy groups are, as you know, we're in pretty careful contact with our long-term care facilities in the county, and we're hearing that they already have some appointments made for those folks to come into those facilities. The 300 doses that we got today, as you know, Bozeman Health got its larger shipment earlier, I think last week. What we're really focusing on is smaller clinics that aren't part of the Bozeman Health network. Those, again, frontline healthcare providers who are more likely to come in contact with the virus. We're also have been reaching out to home healthcare agencies who are going into people's homes, particularly older folks, to make sure that we're connecting with them. And then school nurses, we have a pretty cohesive group. It's not a huge group of school nurses just because of the way school nursing works in Montana. But the school nurses will be doing a clinic tomorrow at the Wilson building. And all the school nurses from across the county are going to be involved in that, not just BSD7, but throughout the county to get vaccine to them. We know this doesn't get us everywhere we need to go, but it certainly is to see that FedEx truck drive up this morning, to see the box opened up and have vaccine come out within a year of this virus. It was just a year ago we were hearing about this virus emerging. We were trying to think through when it was going to hit our shores, and now we've got a vaccine. It's encouraging. It's something that it's uplifting for this holiday environment we're in, and certainly we're doing everything we can to get it out to that 1A group, which is those frontline healthcare providers. As I've said, our goal is to in distributing this vaccine. We have three things that we're really paying attention to. Number one is safety, making sure we're taking care of the vaccine and making sure it's being administered in a safe way. We want it to be timely. We want to make sure it's getting out. That's why we were pushing it out. We were making plans to push it out even before today, and we have people in our community getting those shots even as we speak, and that'll continue tomorrow on Christmas Eve. And we want it to be transparent. And that transparency, we hope, will build some understanding in the community that we don't have all the vaccine we need right now. But as we get further down the road, it's pretty clear cut right now. Giving these vaccines to frontline healthcare providers, there's not a lot of difficult choices to make. We're just getting it out to them. As we get deeper into this, there's going to be more difficult decisions to make. We're going to continue to follow the recommendations from the Centers for Disease Control in the state, but every community is unique. And so we've started pulling together, in fact, they've already started meeting a little bit, a working group with membership from across the community to really help us across the community and across disciplines. It includes people who work in healthcare, both the big systems like Bozeman Health and smaller clinics, childcare, hospitality and food service, our K-12 schools, higher education. We've got some folks in economic development that are working with us who really have sort of a broad understanding of the business community. We've got some representatives of government, and we've got some people who are really helping us focus and making sure we're connecting with underserved populations, and that could be underserved based on ethnicity, their race. It could be underserved based on the fact that they have developmental disabilities, those sorts of things. So we're really trying to make sure that we're reaching out to the community. These won't be decisions just made by the health department. They're really decisions that are going to be made with the help of the community. The vaccine, it feels good. It allows us to go on the offense. That 300 doses is a great start. It's invigorating. Frankly, to see that vaccine come out of the box today, I don't think there was anybody in the room that didn't have goosebumps, and there might have been a few tears here and there, or at least strong-willed people trying to hold back tears. I think when you've gone through something like we've gone through as a community, as a nation, as a world, to be able to see innovation and see those vaccines roll across the threshold is really pretty special. But this is going to take months. We don't have enough vaccine for everybody right away. As it comes out, we're going to work to get it out to people as effectively as possible. It allows us to go on the offense, as I said last week. But while we're doing that, we have to keep playing defense. And so we need to avoid crowds and crowded settings. We need people to continue to wear face coverings, and we need people to stay home when they're sick, wash their hands frequently. We're going into the holidays. It's not the time to let up. Keep those holiday gatherings small whenever possible, and really think about people that you're going to be in contact with, not only at the holiday gathering, but then the days after that. And finally, before I open it up for questions, I want to say more than anything to the community, thank you. Our staff has been talking in recent days, and the entire response staff has been talking in recent days about the sort of overwhelming outpouring of support that we've felt from the community over the past couple of weeks, in really even going beyond that. If you look behind me on my windowsill are just some of the thank you cards that have come in over the past week. I read every single one of them. I get them from little kids. I get them from older folks. I get them from senior citizens. And we get them at the health department too. And I'm trying to share that with our staff. Sometimes I'm the front-facing face of the organization. So I feel that when I go through the community, 99 times out of 100, what I'm getting is a thank you or a pat on the back and an encouragement and people wanting to help. And I'm trying to make sure that our staff and my colleagues here are feeling that as well. And that has really kept us going, and kept my family going personally over the last couple of weeks. What I would say is the thing that everybody can do for us that wants to reach out and support us. We love that outreach. But and there's no but. What we would ask of everybody is that they keep doing the things that have allowed us to reduce transmission over the last several weeks. Avoid those crowds and crowded settings. Wear face coverings when social distancing isn't possible. Stay home if you're sick. Wash your hands frequently. If people really want to honor the healthcare providers who are out there putting it all on the line, if they want to support public health, what we really would like them to do is to help us reduce transmission, because it's really making a difference. It's freeing up our time for vaccines. It's allowed us to dig deeper. The number of cases we have now, we're able to really do contact tracing in a more extensive way. I've talked about in the past how contact tracing is kind of like a fire extinguisher. At some point in time, the fire can get too big to put it out. I think we're seeing the fire come down to the point where the contact tracing is going to be more effective if we can keep the number of cases fairly stable. But we know we have challenges ahead. Our population's going to swell here in the next several weeks when MSU comes back. We are seeing, and elsewhere in the country, in California and Tennessee, states that are going through quite the opposite that we're going through. They're seeing a pretty rapid increase in cases. And we should really pay respect and not forget about the fact that, over 320,000 Americans have died from this virus. We announced deaths yesterday, I think 6 deaths yesterday. People continue to get sick with this virus. It continues to be a really serious situation. And we need to make sure that even as we take encouragement and even as we celebrate what is really an enormous achievement by our the researchers and the doctors and the pharmaceutical companies that have produced these vaccines, we need to really make sure we understand that there's a lot of families. There's literally hundreds of thousands of families that are going to have an empty seat at the table on Christmas. We have lost hundreds of thousands of people this pandemic. And even as we take encouragement, we need to keep that in mind and continue to do the things that are important to prevent further deaths, because we're still seeing that happen, not just across the country, but even in our community. With that, I would be happy to take any questions. Oh, Lauren, I see Lauren's on there too. Lauren, did you have anything before we start?
Hi, Matt. Thank you. I think I would just add that even as we start to get vaccine into our community, it is important, I think, to note that they do require 2 doses of that to be fully protecting folks against the COVID-19 virus. And even after that second dose it is administered, what we're hearing is that it'll take a week or 2 for that full protection to be in effect. So I think to just re-emphasize what you stated, Matt, that we still need to be social distancing and washing our hands and wearing masks is incredibly important, even as the vaccines start to be administered.
And I think the other thing that's important to understand is that this vaccine that's coming out right now is intended and directed to be used by frontline healthcare workers. We're getting a significant number of calls from people wanting to be on a list, wanting to know when they're in line. We don't know how much vaccine we're getting, and we don't know when we're getting it. Rest assured, we're building our systems, we're adding staff, we're identifying facilities to be able to administer that vaccine. But right now, it's really focused on those healthcare workers, and we're proactively going out and finding them and giving them shots. So most of the general public right now, we don't have vaccine to provide to most people right now. We just need people to be patient and know that we're doing everything we can to get it out as soon as we get it in our hands. Questions out there?
Hey, Matt, it's Catherine Houghton with KHN.
Okay.
I just said that as if you can't see my face. I forget we're on Zoom. So one of the things I'm wondering, and this is kind of an interesting question given what you just said. So I understand what you're saying. But when you're talking about long-term care facilities being among those kind of initial priorities, are those including group homes for adults with disabilities?
Yes. So that they're being handled differently though. So the long-term care facilities that are nursing homes and assisted living centers for seniors, the ones that we typically talk about,
yeah,
those are being engaged by those commercial pharmacies that the federal government has deployed, and we're working with our individual long-term care providers that serve those seniors to make sure that they're on the list, to make sure that they're getting that. We've also added reach to that, the group that's helping us figure out what to do, how to get these vaccines out there, and those we're working with those folks. I don't know that they're going to be on this first batch, but they're certainly classified in our 1A group.
Okay, so just were you saying though that adult group homes would be kind of dealt with the same as the long-term care communities as far as the commercial pharmacies?
Yeah, we're currently not with the pharmacies. We'll be using our allocation of doses.
Okay.
Work with the local providers to do that. I don't think that the federal government has figured out how to do that with all of those providers, but we're certainly paying attention to that in Gallatin County and making sure that our allocation allocations that come to the health department, or if we're seeing other providers in the community health partners has gotten some vaccine. Certainly Bozeman Health has gotten some vaccine. We want to be transparent with that. But as we see, and we have excess capacity, and with those frontline providers, those homes would be really near the top of our priority list.
So not yet, but on close to the
Not yet, but very
top
soon.
of the list.
Yeah.
Okay, great. Thank you.
Yeah. Other questions out there?
Hey, Matt, Karen from the Chronicle. I was wondering if you had a
Perrin, you're frozen. I don't know if you're trying to ask a question
sense of
or if,
how many frontline healthcare workers Gallatin County has not Bozeman Health, like that are in.
hey, Perrin, is that Perrin? Perrin, you're breaking up. We can't hear your question right now. I don't know if you can type it into the chat box or, and Whitney can ask it for you, but we can't hear you right now. While she's doing that, are there other questions out there?
Hey, Matt, it's Emma. So I just had a quick kind of, I guess, clarification question, but between the doses of the Pfizer vaccine that Bozeman Health received last week and now the 300 doses of Moderna that you've received this week, is there any difference in the distribution process for those, or kind of how are those two being handled differently, or is it kind of the same distribution plan and process?
Well, they are handled differently. The Moderna vaccine has different storage requirements. Doesn't have to be quite, the deep freeze doesn't have to be quite as deep with the Moderna vaccine, and the time between the shots is different by a week. And I can't remember which is which, but one is 3 weeks and one is about 4 weeks. So yes, there is a difference.
Did he freeze for you guys too?
Yep.
Yes.
Okay, Matt, you're also frozen. This is just a great.
Why Bozeman Health will get the Pfizer vaccine, but they are handled differently.
Matt, you kind of froze in the middle of that.
Yeah, I see that. It says my internet connection is unstable. So yes,
Oh.
Can you hear me better now?
Yeah, much better now.
Okay. So the bottom line is, yes, there is a difference in the way you store them, and there's a difference in the way that we, one's 3 weeks and one's 4 weeks when you get your booster shot. And I can't remember which is which off the top of my head. The doses that went to Bozeman Health were the Pfizer doses, my understanding. We got the Moderna doses today, but again, we're going to be following up with those folks to make sure that they're getting the same vaccine. That's going to be a major challenge, especially when we go to the general population. Really getting people to understand they need to come back for that second dose. One really isn't good enough. We want to make sure we get 2 doses in people, and you can't mixy matchy. You got to really have Moderna or Pfizer. So that is a significant challenge. I would say though that we're seeing at the state level, there's some software systems that are being unveiled that are national systems. We're adding staff to help us through our incident command with that. It's going to be a challenge, but I'm really encouraged and really optimistic about it today. We've engaged our emergency management. Patrick Lonergan is involved. Deputy Fire Chief Mike Maltaverne is our incident commander right now. That's freeing me up to do some things. We've got Buck Taylor, who's on the Board of Health, is helping us run that consultation group that's helping us make decisions on vaccine allocation. We've got other first responders who are helping us with figuring out pods. We've reserved some space at the fairgrounds to be able to give shots there once we get to the point where we want to have those larger clinics. So there's a lot happening, and I'm really encouraged by the amount of help that we're getting in the community. It's not just the health department. It really is a community-wide effort.
great. So just a little follow-up. I know obviously everyone, as you just explained, is working together and being really collaborative on this and on vaccine distribution in general. But since the Pfizer went to Bozeman Health, they're handling the Pfizer distribution, and then you guys, the health department, is handling the Moderna doses, that distribution, or is it crossing over?
I don't know if Bozeman Health will get Moderna or will get Pfizer. I think the point is the first doses we got were Moderna. We'll be prepared to handle the Pfizer if we have to, and I'm sure Bozeman Health will be prepared to handle Moderna and keep them straight if and when they get shipments of those. It's not just clear cut. Hospitals get Pfizer all the time and health departments get Moderna all the time. At least that's not what's been told to us at this point in time.
Okay.
Matt and Emma, this is Lauren with Bozeman Health. Bozeman Health Deaconess Hospital did receive 800 doses of the Moderna vaccine today. We also received 100 of the Moderna vaccine for Big Sky Medical Center employees. So Big Sky Medical Center employees will start being immunized this afternoon at 2 o'clock. We did restart our immunization clinic with that Moderna vaccine for remaining healthcare employees earlier today, and that will continue until about 4:30 today. We won't be able to get through all of those 800 doses today, so that will again continue early next week. But I think to help further clarify, my understanding is that the doses that the health department receives will not be going to Bozeman Health employees. The vaccine doses that Bozeman Health receives will not be going to those groups that Matt identified earlier.
Perfect. Great. Thank you, Lauren.
Sure.
So then tomorrow I think the schools are planning a Christmas Eve clinic for school nurses at the Wilson building as well. So.
Matt, this is Perrin. Can you hear me now?
I can, yeah.
Perfect. Okay. Sorry about earlier.
You're good.
I was wondering if you had a sense of the number of frontline healthcare workers in Gallatin County who aren't Bozeman Health employees, like the number of people in the first priority group for the
I don't know that I have a number. I know that we've focused in on the practices. I'll have to ask our team if they have a specific number. I would imagine it's in the hundreds, and especially if you start counting in the home health agencies, places like Bridger Care, those kinds of places. So I think we're looking at numbers in the hundreds, but I don't have an exact number for you right now.
And how did you guys choose to prioritize home health workers and school nurses in this first round of vaccination?
Well, it wasn't really just our choice. We were really looking at the CDC guidance, and they were talking about frontline healthcare providers, and certainly school nurses and home health providers fall into that category in our view. We're also seeing a vulnerability there where we wanted to keep our schools going. It's been a major priority, and we also know that those home health aides, if they're infected, they're not only it's not only bad for them, but they're going from home to home to home. And so there's a significant amount of risk involved with that. And there often are small independent organizations. And so those things combined really caused us to really focus on that. And that is coming out of our work with long-term care, with the work that we've been doing with those senior serving organizations and understanding the potential for infections and spread in those organizations. So if we can reduce that risk, that's a pretty big deal for the community.
Thanks. And I had a quick question for Lauren. With these doses of the Moderna vaccine and the Pfizer doses you received last week, will Bozeman Health be finished vaccinating all of its frontline healthcare workers, or are you expecting more doses of the vaccine to finish that up?
Sure, great question, Perrin. So we received 900 of the Pfizer doses last week. Out of that, because of the way the vaccine was packaged, we were able to utilize a few more doses with that. So we in total immunized 1,147 employees last week. We have about 18 to 1,900 frontline clinical healthcare employees throughout the healthcare system. And so that the Moderna vaccine that we received today will go through to supplement that and then immunize the rest of our employees as well.
So you will be done after with your frontline workers after next week?
That is what we anticipate, yes.
Great, thank you.
Sure.
And to
Other
follow up
questions?
with, to follow up with that, if I can, Lauren, does that include the contract nurses who are with Bozeman Health, traveling nurses and other health professionals who are here temporarily?
Sure. I can get clarification for you on that, but one of the criteria that has to be met is that when we give the first dose, they have to be available to receive the second dose. So my understanding is that that might pertain to some travelers, but not others. But I can get more clarification on that for you.
That would be great. Thank you.
Sure.
All right, other questions out there? Okay, I hope you all have a good holiday. We'll be in touch. If anything significant happens, we'll come find you. We're going to continue working on getting.
I'm going to just sneak in here really quick to let the local media folks know. So Matt had mentioned that our school nurses will be getting the vaccine tomorrow. You guys are welcome if you wanted to go observe that, get footage of that. So like he said, it's at 10 a.m. at the school administration building on Wilson Avenue, or the Wilson building, excuse me, on Main Street, I should say. We're not on Wilson. And again, it's at 10 a.m. and you can go in the door, the Babcock side door. And I will email this all out to you in the follow-up with the recording of this call. Rebecca Spear, who is the district nurse, will be your point person tomorrow if you're interested in showing up and covering that. So.
And that's at a BSD 7 building, but it's for all school nurses throughout the county. So. Okay, folks, thanks for your time. Have a great holiday.
You too, Matt. Take care.
Thanks, Matt. Happy holidays.
Happy holidays.
Happy holidays to all also. And they're all gone. Shoot, too late. See you later, Wendy.